claim the free market will suddenly, after decades now, start providing health care to everyone, or whether they believe the only way to ensure universal health care is for the government to provide universal health care. The goal everyone agrees on is universal health care. The current best option under debate is what is called the public option, the government insurance plan run not for profit, but for people because we can, with rates tied to Medicare's rates so taxpayers get the best deal possible, an alternative to private insurance, not a replacement. And so in our fourth story tonight, I called last night and call again tonight for us, all of us, because we can, to get behind the National Association of Free Clinics, which represents 1,200 free clinics around the country and sponsors free health care fairs, like last month's in Houston, where 1,500 people lined up before 5 o'clock in the morning to get free health care because they had to. In doing so, we can get us closer to health care for all, but we can also, as I said last night, can support an organization that stages some of these fairs in cities where they can do not just medical good, humanitarian good, but as a sidebar, political good for the entire nation. Specifically, if these fairs were to occur in states represented by those Democratic senators, like Leader Harry Reid, not yet committed to opposing a Republican filibuster of the public option, to ensuring that the public option gets an up or down vote, so they can see for themselves what is at stake, the faces of Americans, their constituents who need their help. Reid in Nevada, Blanche Lincoln and Mark Pryor in Arkansas, where most people and 4 out of 5 Democrats favor the public option. Max Baucus, the finance chairman in Montana, where 70% voted to expand children's health coverage just last year. Ben Nelson in Nebraska, where Republican support for his handling of health care is 3 times higher than is Democratic support. And Mary Landrieu in Louisiana, 49th out of the country in health care, according to a study that just came out today. Towards this end, I will donate $50,000. $10,000 for each of those states I just mentioned, where the National Association for Free Clinics is able to stage one of its fairs. If we succeed in holding these fairs, however, we may still fail in the political goal. These Democrats may block their own party's up or down vote on the public option that favors American public favors, rather. If so, we still will have succeeded in our ultimate goal, our higher goal of making health care available to our fellow citizens, if only for a day, because we can. I'm proud to be joined tonight by the Executive Director of the National Association of Free Clinics, Nicole Lamoureux. Great, thanks for your time tonight, Nicole.
Thank you for having me.
First, tell me a little bit about the people who benefit from your work, from the clinics that you represent, and from the health fairs that we've been talking about tonight.
Well, the people who benefit from free clinics every day, I think that's the first and most important thing for us to remember, is that there are 1,200 free clinics that are open and operational every single day. And our patients, 83% of them are working. They come from working households. They're just like you and I, and they have no place else to go.
What would, thus, for those people, the people who turn to you now, what would a strong, robust public option mean?
Well, I think what we need to make sure, all of us need to make sure, is that when we talk about a public option or universal health care, what we really mean is access to quality health care. That we are talking about more than just an insurance card, but a place for people to go, get the medical care that they need, find a medical home, and get healthy and live good lives. That's what they really need.
You are, in the very literal sense of this term, on the front lines of the healthcare crisis in this country. I would imagine that at least the Democrats, if not the Republicans in Washington, have been picking your brain about who needs help, what can be done, the best and most economical way of doing it. And yet there's a voice inside my head that's saying, you know, maybe not. Which is it?
I think you should go with your voice that says maybe not. Unfortunately, we keep going to the Hill, and we try to talk to Congress, the House, the Senate, and the President, and we just stand firm to say that we're here, and we would like to help the administration and the Congress to discuss the important issues of the population, which last year was 4 million patients. This year will be 8 million patients at free clinics. We have a very unique delivery model. For every $1 donated to a free clinic, $5 in services are given to patients. And that's being done with little to no state or federal funds as it is right now. We feel that we have something to give to the conversation, and we just hope that someone will come and talk to us sometime soon.
Yeah, you don't want to talk to the government if you can take $1 and make it into $5. The government plan is to take $5 and make it into $1. That's the essence of the equation. But you now, as I understand, have committed here to stage at least one of these great healthcare fairs in one of of the states we just mentioned, if we can get the resources together to make it happen, what exactly do you need, and have you seen any signs of support for these particular ideas so far?
We have seen ideas of support. Just let me tell you that we had 407 people donate for $34,773 already from last night to today. And we are, as the National Association of Free Clinics, committed to putting on one of these health fairs for this very important issue, as long as we can get some funds. And what we need, we'll need a place to hold this. We need lab support. We need tons and tons of volunteers, doctors, nurses, support staff, in order for us to make sure that the people who are coming get the quality care that they need. So we need a lot of help from everyone, and it can be help that at any level, whether it's your time from $5 all the way up. That is what we need in order to make sure that one of these clinics takes place.
The big ticket end of this, I would assume, is not doctors, nurses, medical equipment, the people who are so gracious and generous in these occasions always, but practical stuff like where you're going to hold it, right? This is about venue mostly, isn't it?
It is. I think the biggest thing that if we could get under our belt would be the location. Then we can really move from there. And if we have the location and someone is willing to donate that space to us, then more of the money that's donated can go to the actual delivery of care.
So what we need is something in Butte, or we need a nice arena in New Orleans, or a facility in Vegas that would like to be associated with, you know, being on the right side of this equation. That would be a nice start, correct?
That would be a wonderful start.
All right. Well, we'll see what we can do. We'll keep mentioning this here and stay in touch with you. And I don't want to start sounding like Jerry Lewis on Labor Day. I don't want to verge into his territory. That's his group. But I'm greatly moved by your work and by the time you've taken to be with us tonight, Nicole.
Thank you very much.
All the best.